I graduated medical school in 1950.
There you go. A long time. When was it that you started to think there is something more going on here with people than just a bad back?
That's very simple. I was asked to head up the outpatient department at this Rusk Institute of Rehabilitation Medicine in 1965, and was then exposed for the first time in my medical career to large numbers of people with back pain. And it was then, and of course has become an enormous public health problem now since then. And I used the conventional diagnoses and treatments for a number of years, for must have been about 7 or 8 years, and with great disappointment, great frustration, because people just didn't get better. And I noted, and this was the important thing, that all of the patients practically that I was seeing had histories of other things which I had considered mind-body for many years, like the common allergies and the common headaches and the common stomach problems and the common colon problems and so on. And then I said, wow, wouldn't it be amazing if this physical thing turned out to be the same sort of thing? And of course, that was the beginning. And I began to put that into practice, and obviously one always had to rule out any important structural abnormality and things of that sort, but that wasn't difficult to do. And that was the beginning, and little by little, through the years, I learned more and more about how it works physically and how it works psychologically.
And how does it work physically, that your brain does this to your body?
Yeah, well, actually, your brain does it to your body, believe it or not, to protect you. And that is to protect you from emotions that it considers to be either threatening and dangerous, like intense anger to the point of rage, or from emotions that are too painful, too unpleasant, and so on.
So it's
really
like focus on this pain, not on
Yeah, in
that.
fact, the strategy works. In other words, the brain knows that if it gets you to focus on the pain, then you will not be, first of all, your anger will certainly not come out. In all the years that I've been doing this, 34 years or so, I've had only one patient who had an experience where some of those emotions exploded out, and that was an extremely unusual circumstance of a woman who had been actually sexually abused by her father many, many years ago. But otherwise, the symptoms don't tend to come out, so the strategy works. And what do we have to do to get rid of the pain?
Well, first of all, before you get to that,
Yeah.
what is the body, how does it cause the pain?
Well, actually, the brain,
has
has control of all sorts, everything that goes on in the body. And there are different systems that may be involved. For example, the system that's most commonly involved is known as the autonomic system, and that controls involuntary function. It controls the circulation of blood, which is how it produces symptoms here. The brain simply decides, I'm going to reduce the blood flow to these spinal nerves down in the low back area, and that will produce pain. And it's very simple, and fortunately, very benign, very harmless, because the degree of oxygen deprivation that results from that is quite minimal, but enough to produce pain. And of course, that's the heart of the matter. Yeah. And so it does the same thing by interfering with normal function in the stomach, for example, and you have reflux. It does the same thing by interfering with normal function in the bowel, and so you have irritable bowel syndrome, and on and on and on.
So you really believe that that TMS is not just about back pain, it also is...
I call these other things equivalents. In other words, yes. They're not part of TMS. By the way, was I specific? I now call it tension myoneural syndrome. And anything that I'm writing now And of course,
You
what
say
we're doing
that.
now, I want it to be known that it's myoneural, which is closer to the exact situation, because the other tissue that may be involved, in addition to nerve and muscle, are tendons. A lot of the pain that people have in the knees and elbows and shoulders turns out to be tendon pain due to TMS. But these other things I call equivalents. In other words, the psychology is the same. This is fascinating. I had a telephone call from a woman today, 81 years young, who told me, and I can't reveal too much, but there was a catastrophe in her life 3 years ago. And she began to have symptoms for the first time in her life. First, it was some urinary problem. And then she developed, and she went to the doctors, and they cleared that up. And then she developed pain in the shoulder, and she went to a chiropractor, and he cleared that up. And then she developed sciatica, and she went to someone, and that was cleared up. And then she developed what she has now, which is pain in the neck. She came across my books and said, I think these were all related, and I said, they certainly are. What do I do? Well, you obviously got to come in and be educated and find out the details, because she had read the books, some of the books, and she was aware of how it worked.
So for some people, simply knowing about this works for them?
Yes.
Just learning that.
That's why so many people have gotten better just from reading one of the books. It's very funny. Sometimes a patient of mine, after they've been treated, say, well, you know, I've been buying the books and giving them to my friends. And this one guy read the book, and the lucky guy, his pain went away. All he had to do was read the book.
So for some people, just learning about this works.
Yes. Yes. Yeah, and I think that why people are able to get better just from learning about it is that what's going on psychologically is not quite as heavy in those people as it is in others who require more than that.
More than that, as
that is more than what they can get from the books, who need to come in and see me, have the diagnosis confirmed after an examination and so on, attend the lectures, attend my meetings and so on. So they need more.
And do some people need psychotherapy as well?
And you anticipated what I was just about to say. In about 20 to 25%, psychotherapy is necessary. And of course, our therapists are all thoroughly trained, and they were all trained originally to work on the unconscious. Of course, that's the heart of the matter here. The title of my last book is The Divided Mind. The conscious and the unconscious mind.
But how do you know what's going on in your unconscious mind?
Well, you see, that's interesting. You can't identify it by tests. You can't identify it even you do an MRI, and that doesn't tell you what's going on in the unconscious mind. You do more sophisticated studies that neuroscientists are doing now, and that doesn't tell you. It's a matter of learning and by observation, of course. Freud originally made us aware of the unconscious mind and wrote volumes, as you know, about what he had learned and what he had gleaned. And you talk to people. And so it's really not terribly difficult. You'd be amazed. Every patient I have ever seen who's come to me has certain personality traits. It is so consistent. They are hardworking, conscientious, responsible, people who expect a great deal of themselves, like Donna Hamilton. And we call that the perfect tendency. And then the other is they almost invariably have a need to be very good people. Helpful.
That's me too.
Yes, of course. Very helpful.
Double dose.
That's right. Now, the question then becomes, well, why is this a problem? It certainly is not a problem in our daily lives. It's magnificent in our daily lives. In the unconscious, it's a problem because it puts certain elements within us under pressure. And that, of course, gets us to a more sophisticated level. So I think I would have to leave it at that. Otherwise, people listening to this or looking at this won't really understand.
Yeah, but it's pressure from outside, but also pressure we put on ourselves.
Both. It's pressure from outside, and pressure we put on ourselves is an even greater pressure. That's right.
And all of that
cause
pain.
Yes, and the pressure results in anger, in intense anger, and that's probably the main reason for symptoms, to make sure that that anger does not surface, that it does not become conscious.
That is really fascinating.
Oh, it is. This is very interesting stuff. And I keep learning every day about, within the last few weeks, I've introduced a new idea, a new therapeutic idea to the people that I'm working with, because I think it may help to get the job done.
But we're talking here about chronic pain, and not pain that maybe I feel this morning because I worked too much in my garden this weekend.
Oh, no, both. We're talking about both.
Seriously?
Oh, sure. Because you assume that it's because you worked too much in your garden this weekend, but if this annoyed you sufficiently and you felt you had to come to see me, and I'd say, no, it's because you're a perfect and you're a good. It's not the working in your garden. That's right. Yeah.
You're a perfect and you're a good.
Yeah. And what's going on in your life? What pressures are there in your life? Mm-hmm. Oh, that is very definitely, and I'm glad you mentioned it, a factor in this. In other words, those two areas, the pressures we put on ourselves and the pressures that life puts on us.
Or clearly, things that have happened in our past, from our childhood even.
Well, that's the most subtle one, and that's the one that a lot of people find hard to believe because they think their childhood was just beautiful. And, you know, the mom and dad were great and so on. And it's true, mom and dad were. But there are certain factors that lead me to believe that in virtually every one of us, we carry away some things from our childhood that are, well, in fact, why? What made you develop these traits of the perfect and the good?
Trying to please your parents.
Exactly. And so you carry that right on into adult life. Hey, you'd make a very good patient.
A little reading is a dangerous thing.
Yeah.
Yeah, that is really interesting. Now, how has the medical community dealt with you over the years?
Oh, it's very simple. Totally ignore what I'm doing and totally unaware of what I'm doing.
Really?
Totally unaware.
But here you are. You're in New York in the Rusk Institute.
I'm a full professor here in the NYU School of Medicine.
How can they ignore that?
They can ignore it, but they don't read my books, and you see, the point is that it doesn't fit with contemporary medicine. Contemporary medicine, is really the last since the mid-1950s. Prior to that, doctors very much had in mind the possibility that emotions could influence illnesses, and there were many papers published in peer-reviewed journals. They were totally ignored now, and they were about things that people are seeing now. But since the mid-50s, medicine has become increasingly, mechanical. Increasingly a matter of let's identify what's wrong and then let's fix it. Fix it with a knife or fix it with a drug or fix it with something else. But the idea that the mind might be playing a role in these things is totally absent from medicine today. You realize that treating pain in the United States is a major industry. I mean, billions of dollars are spent every year. In fact, there was an extremely important article published in the Journal of the American Medical Association on February 13, which you can pull up on the internet. And what it said was, and it was meant to indicate what the statistics were. It didn't theorize about anything, about why. Maybe a question at the end, we don't understand why so many people have this. What it demonstrated was the